Hi, drug repurposing is hot news for rare diseases. Today we're going to present an example of how technology can be repurposed to create a new normal for non-motor seizures. I'm Alison Watson and I'm joined by Tim Buckings from EpiHunter. Both of our sons have ring 20. Imagine having a physical impairment that cannot be seen. You appear perfectly normal from the outside, but this belies what's going on inside your body. Take epilepsy as an example. Absent seizures can be easily missed by onlookers, and yet they can have a significant effect on the individual if they remain uncontrolled. So let's take a look at their needs. There's a delicate balance between the needs of the individual, their carers, and the needs of those that have the power to change their lives. On the one side, families and carers face feelings of insecurity. They need to be understood and ultimately believed. On top of that is the pressure to accurately record hundreds of seizures. On the other side are the healthcare professionals who are time and cost constrained. They need to be they rely heavily on historical recounts by families, which can be very subjective. Payers need reliable information to provide the necessary services for patients in health and social care. And pharma and researchers need real-world evidence and clear efficacy for new treatments to be successful. At the centre of all this is the individual, juggling their emotions as well as their symptoms. They often feel powerless and excluded from aspects of society. On both sides, there is a need for definitive proof to facilitate positive change for that individual. If only we could see what's going on inside their brain more easily. Whilst healthcare professionals initially focus on controlling seizures, with drugs usually, for many rare epilepsy patients, these often remain ineffective. And these patients have to learn to live with their symptoms and the side effects of their medications. So families seek practical solutions alongside to manage their day-to-day lives as best they can. And this is backed up by science. Controlling seizures isn't the only consideration when measuring quality of life for children with epilepsy. In fact, mental health and social support are key too. Children benefit from practical interventions alongside their medical treatment. Translate this into the digital world and imagine what impact technology could have for people with rare epilepsy if you could see the signs and act on it. I'm going to hand over to Tim to tell you a little more.
Thank you, Alison. Practical solutions are commonly used for many conditions. Let's take the example of wearing glasses. Glasses don't cure bad eyesight. They alleviate the symptoms so the wearer can see the world around them. They read books, drive a car, use a computer. Glasses act as an enabler, empowering the user to remain fully included in society, safely. And this is what is so important and why many people wear them. Translate this into the digital world and imagine what impact technology could have for people with non-motor epilepsy, if you could see the signs and act on it. And with EpiHunter, we repurpose technology to play an instrumental role in daily life with epilepsy. As mentioned, I'm the father of a son with daily absent seizures. And when he was 10 years old, the biggest impact of his epilepsy on his life was that people were always angry at him. And on March 15, 2015, during a bedtime conversation, he said, "Papa, you work in digital. Can't you create a light that turns on when my brain switches off? Because then the teacher would see when he has a seizure and therefore not be angry when needed to repeat instructions or give him more time for a test." And that was an epiphany moment, as I immediately realized that a simple light would remove the impact of his epilepsy to the classroom situation. And by externalizing brain state, we could impact the lives of millions of families worldwide struggling with the invisibility of non-motor seizures. And if we could detect and signal seizures in real time, we can create an automated seizure diary to help the physician for faster diagnosis and treatment optimization. And who knows, one day the huge volume of daily life EEG data could bring and help drug development and testing to become faster, less costly, and therefore within reach for rare syndromes like Ring 20. So that's exactly what we did. We repurposed the technology used by hospitals since the 60s. I learned that this technology, called EEG or electroencephalography, which collects brainwave data with electrodes on the skull, is being adopted by consumer electronics, entertainment, and wellness companies. And these startups, scale-ups, but also multinationals are creating more and more cool-looking EEG wearables aimed at helping us sleep better, concentrate, meditate, game, or even make us better at sports. And due to the much higher volumes than in the medical space, it will make the technology iterate and improve at much faster cycles. And that is fantastic for people with neurological conditions, and epilepsy in particular, because these cool-looking wearables can also be used by people with such a condition. And that is exactly what we do. We bridge both worlds by using a consumer EEG headband to collect EEG data good enough to automatically detect and signal seizures in real time. And by doing that, we remove the impact of absence seizures in a classroom or outside, but also provide much more insight in seizure frequency, duration, etc. We take away the guesswork from clinical follow-up. Today, more than 150 families in Belgium, the Netherlands, and UK use EpiHunter, mostly children, but also adults. And the impact is there every day, but it is still small numbers. We provide neurologists with objective seizure diaries, EEG tracings, and seizure videos, including 30 seconds pre and post-ictal footage. Especially in times where COVID-19 increases the need for efficient and effective teleconsultation, the data and insights become even more critical for good care. And who knows, one day, solutions like ours can help pharma to create a new precision drug or help testing to repurpose drugs. Today, Alison and I want to illustrate the potential value of digital technologies, how it helps to answer the needs for objective data in the care pathway, but also to create changed life settings and perhaps a new normal in which epilepsy matters less. Thank you.